Hello, everyone. I'm Dr. Marty Ross, and tonight this is another Conversations with Marty Ross MD. Hold on just a minute, let me adjust this. So as you all know, this is a webinar where we're going to discuss Lyme disease, and our discussion is based on the questions that you asked me. As usual, I'm interested in seeing what you have in store. For those of you that are new here, I'm glad to see some new faces, and I'm also glad to see there are a number of people that have come back too. I suspect the people that are coming back are getting some value out of this, and I hope you newcomers get some value out of it as well too. There's a couple ways that everyone can participate tonight. Number one, you can see the questions or hear the questions, because I'll read them out loud, that people have written in, and see what responses I give. The other way is actually go bold and write a question yourself. And where you can do that, there's a chat box on your screen, and you have two options there. There's a question mark option, and there's another one that looks like two talking screens. Use the talking screens one. I prefer that, just makes it simpler because they all wind up in the same place basically, all right? The other thing I ask is while you're typing your question, don't hit the enter key until you've written the whole thing out. Write it as one long run-on paragraph. The reason is each time you hit the enter key, it sends that thing that you've written to me, and it becomes very difficult on my side to chase around pieces of your question, okay? Finally, what works best here too is shorter questions, not long questions. This format does not work out well for long questions, all right? And if they are too long, I actually sometimes I can't handle them because it just becomes too difficult in this kind of a setting to do it, all right? Now, as usual, I am creating a recording of tonight's webinar, and sometime tomorrow morning, early in the morning, you should get an email from me saying that that is ready. I create a synopsis for you as well about what we talked about. When you get that, you'll have a chance to sign up for my next webinar in a week, and that will be our last one in July then, okay? And yeah, I think that covers most. Oh, when you do get that, share it with other people. Let them know what we're doing here. Let them know they can sign up for next week's webinar, and let them see the videos that we create from the questions that you ask as well too. All right. So without any further ado, let's go ahead and get started. One last thing, I will read the questions to you. Those of you that are here in the live webinar, which is all of you right now, basically will be able to see it on your screen. People in the recorded version cannot see the questions. They don't get recorded actually in the video. So just to make you aware of that. So, but if you are in the live version right now, you'll be able to read along as I go through that question. Okay. All right. So first question is from Allah. I think it's Allah, although I asked you maybe last time what it was, and I can't remember now, but anyhow, welcome back. Hi, Dr. Ross. I think it's the same one, at least. Anyhow, hi, Dr. Ross. I'm suffering from the 3 Bs, mainly treating Bartonella for severe neurologic issues with occipital burning, floaters, light sensitivity, and the hallmark pain on the soles of the feet. I feel as though I have fever almost every day that I take my medication. Mild temperature, stuffy, I call it. The phantom fever. It's like I almost have the flu, but then I never do. Is it common to have a Herx daily if this is even a Herx? Does Bartonella cause Herxes like Borrelia, even though it's not a spirochete? And what can I do about this? Currently on rifampin, azithromycin, cinnamon clove, and oregano, I take glutathione, ATB probiotic, and a multivitamin daily. As a point of reference, this phantom fever began the day I started Doxy in May last year. Okay. So I want to clarify, and I think I just want to be clear about this. So it looks like right now you are not on doxycycline. And the reason I'm trying to clarify that is if that is true and you're not on doxycycline right now, that eliminates one thought I have as to what could be causing a temperature, low-grade temperature. So doxycycline as a side effect sometimes gives a temperature, and sometimes doxycycline can trigger autoimmune illnesses, which give you a temperature as well too. So if you are still on doxycycline, which it doesn't sound like, but if you are, you might want to try coming off of that to see if it will help with what this temperature is that you describe, okay? All right, and then let's talk briefly about what a Herxheimer reaction is. So yes, Herxheimer reactions can occur when you treat Borrelia, which is Lyme. They can occur when you treat Bartonella. They can occur when you treat Babesia as well too. And essentially what happens in a Herxheimer reaction is the immune system reacts to seeing all the toxins that get released from the dead germs, and also to the proteins and the other parts of the germs. All right. So the immune system reacts to the dead bug parts. That's what I try to say. And what the immune system does when it sees these dead bug parts, it reacts by making more inflammation chemicals called cytokines. Now, cytokines are already being made in excess by your immune system if you have a lot of Lyme disease or Bartonella symptoms. And so let's talk about cytokines real quick. So cytokines are inflammation chemicals made by white blood cells that first see a germ. And what they're supposed to do is the white blood cells release these chemicals called cytokines, and they're supposed to turn on the immune system. They're supposed to cause more white blood cells to be made, help draw those white blood cells to where the infection is, and help the immune system work better. Okay, that's all good. However, when the immune system is having a hard time dealing with a problem like mold toxicity, with toxins in you, or too many yeast in your intestines, or Bartonella or Borrelia babesia, it's going to try harder and harder. And eventually it's going to try so hard that it makes too many cytokines, all right? And too many cytokines give you what we call Lyme symptoms. They make you, or Bartonella symptoms, right? So signs of too many cytokines include possibly low temperature, or low grade temperature, I should say, possibly fever. You can have confusion. You can have brain fog. You can have fatigue. You can have insomnia. It gives you body pain, makes you hurt all over, can disturb how all of your hormonal systems work, etc. So basically, the symptoms that we call Lyme, or tick-borne infection symptoms, or mold toxicity symptoms, or too many yeast in your intestines symptoms, the majority of those are due to excess cytokines, all right? So when we have a Herx, usually what's going to happen is the baseline excess cytokine symptoms you have will get worse because the immune system sees these dead bug parts and will make excess cytokines. Now, a Herx usually is only going to go on for about a week or two. It's typically not going to be something that continues on and on. So if you are having symptoms that remain on and on as you are, it sounds like a worsening that has been going on for a year, that sounds like it could be part of your underlying illness. All right. Now, I have to give you a warning. I only get this snapshot question you have here. I can't ask you a bunch of detailed questions to follow up. But in general, when you've got symptoms that have been persisting, worsening for a period of time, it's likely due to the underlying illness and is unlikely due to a Herxheimer reaction, okay? So one thing that I would do is probably get a bit stronger with how you are working on your cytokines. And so there's a couple ways you can attack excess cytokines. Number one, you want to, since they're made inside white blood cells, there's things you can take, supplements you can take that will interfere with the white blood cell production line, okay? So one of the things I like working with that will interfere with the white blood cell cytokine production line is curcumin. Curcumin is a component of the seasoning turmeric, and it does get inside white blood cells and limits their ability to make as many cytokines. I like using a product for that called curcumin phytosome by a company called Thorne. It's a liposomal type of curcumin, and the fact that it's liposomal means it's mixed in with various fats to increase its absorption, because curcumin and even turmeric are not that well absorbed on their own. So it's a way of helping it, okay? It comes as a 500 milligram pill. And at a minimum, I have people take it as 500 milligrams 3 times a day. And if that doesn't alleviate some of your symptoms, you can go up to 1,000 milligrams 3 times a day. I like to couple that for cytokine control with the glutathione. Oh, I know you're on glutathione right now, right? So I like using a liposomal glutathione as well, too, because glutathione is poorly absorbed unless you mix it in with a bunch of fats to increase its absorption. The product I prefer for that is something called Trifortify. But regardless of what product you're using, you want to get somewhere around 500 milligrams in 1 or 2 times a day. And what glutathione does for cytokines is it blocks oxidizing agents that tell the white blood cells to make cytokines. So you got curcumin on the inside interrupting the production line, and you got glutathione on the outside of the white blood cells swatting away oxidizing agents that are telling it the white blood. So you're really working from 2 angles to help control those excess cytokines that are part of a Herx reaction. Okay. And so that would be based on what you've written here. That's what I would suggest. The other thing, I would make sure you've talked to your provider, because there is some times that, or your prescriber, who's ever prescribing your rifampin, maybe the azithromycin too, but there are certain drugs when we take them, certain antibiotics that can give you what are called drug fevers. And a drug fever basically is an autoimmune reaction against the actual antibiotic. I'm not sure. I don't think of azithromycin as doing that. Let me double check to see what happens if rifampin can do that. Hold on here just a minute. I'm looking in my drug directory here right now. It's possible. There are a number of autoimmune situations that can happen with it. You need to make sure that your provider knows about this temperature, low-grade temperature elevation, because sometimes that can be an autoimmune reaction as well too. Okay. All right. Again, I only get a snapshot of you, so you may want to talk with your provider and see some of the things I recommended make sense for you as well too. Okay. All right. Good luck to you, and thanks for the question. Let me do a quick screen share here too. All right. So in my online Lyme guide, which is this Treat Lyme by Marty Ross MD, if you hover over my online Lyme guide, take a look at this section here called Herxheimer and cytokines. All right. And there's two articles that are pretty similar. One is about steps you take to control cytokines, and the other one is how do you handle a Herxheimer reaction. All right. And in here, in the Herxheimer reaction, I talk about cytokines. I talk about the various things you can do to lower them. And I give you some recommendations on steps to do. These are very similar to the steps that I have over here in my control cytokines article about steps you can take to manage those cytokines while you're treating as well too. Okay. All right. And then in terms of that product I recommend, so it is called curcumin phytosome, and this is it here. I like this product for my curcumin mainly because of the absorption of it. Okay. Keep in mind, so this is my supplement store. It's where my patients, when I was treating in my clinic in Seattle, used to get their products from. These are available to anyone. Basically, I have curated what I find to be effective products and ones that have good quality, basically. All right. Anyone can buy from here. Some advantages to buying from me is that I've curated some good products. Number two, I pay for your shipping if your order is over $50. Number three, I cover any state or local taxes if they would be required. I cover them for you. And number four, we ship fast. Anything that comes into my location in Austin by 2 p.m. Monday to Friday goes out the same day. Okay. All right. So keep that in mind. All right. Let me go back here. All right. Good luck to you again. Hello, Nilafar. Let's see. Hi, Dr. Ross. Thank you for your continued support. You're welcome. Let's see. I have Lyme, Bartonella, Babesia, and after 2 years of antibiotics and herbal treatments, I am not that much better. My doctor had me stop my medications to have a break for a month. Could you please tell me where to restart now? Thank you. All right. Let's see here. All right. So if you've been doing this for a couple years and you have not had much improvement, there's a couple things that I would suggest you take a look at. Okay. And I want to let you know that sometimes that is 2 years and you don't have improvements. Okay. But when somebody goes on this long without having any improvements, I want to make sure that something else isn't being missed, basically. All right. So the first thing that can look just like tick-borne illnesses, even if you have a positive tick-borne positive test, it doesn't always mean it's the infection that's causing your problems, all right? Because, these tests that we do are basically immune tests, and they say, has your immune system reacted against something? It doesn't tell us whether the immune system got rid of that thing or not, which it sometimes can, all right? But two other conditions that look just exactly like tick-borne infections. One is mold toxicity illness, and the other one can be too many yeast living in your intestines. All right, so let's talk about both of those. So the key reason that they can look like tick-borne illnesses is both those conditions result in the immune system overreacting and making too many cytokines, all right? And as I said earlier, it's too many cytokines that give you tick-borne infection symptoms, and it's too many cytokines that give you mold toxicity symptoms, and it is too many cytokines that give you a significant amount of your intestinal yeast overgrowth symptoms as well, too, all right? So in somebody that's not making good headway, I always want to go back and relook at, could there be mold toxicity? And maybe you don't even know you've been exposed to mold. So 25% of us, when we are exposed to mold toxins from mold living behind our walls in our homes or our workplace, 25% of people cannot get rid of them. All right, we breathe them in, they get absorbed through our lungs into the bloodstream, and they get trapped in us. And now what happens in 75% of people is we breathe those mold toxins in, and our immune system will see it, and they will basically break those mold toxins down. The immune system does, and they don't bother us, all right? But if you're one of the 25% that cannot break down those mold toxins, basically they just sit there, and the body does try to get rid of them. One of the things it tries to do is detoxify them in the liver, but the liver can't handle them. And they come out of the liver still as a fat-based toxin. They go out into the intestines then from through the gallbladder and the bile system out into the intestines, where they get reabsorbed right back into your bloodstream, and they keep triggering all these excess cytokines. So if you are not getting better, and if your providers have not done anything to look for mold toxin illness, you should look for it. And my favorite way to test for it is a urine test through a company called Real Time Labs. If you have, you can pee out some of these mold toxins. It's not that you're not going to get rid of them that way. There's a small amount that get peed out. But if you pee them out in your urine, that suggests that they're actually in you in large amounts. Okay. So the company I like using is a company out of Texas called Real Time Labs. I believe they may have just been recently sold themselves to another lab, but I still think they're still called Real Time Labs. Okay. All right. All right. So that's one thing. Second thing, consider if you have too many yeast. All right. So from being on herbal and prescription antibiotics, there is the possibility that you've developed too many yeast in your intestines, even if you've been doing things to prevent them, like you've been taking probiotics, or you've been taking nystatin or herbal anti-yeast medications that kind of swat those yeast down. They can still overgrow. All right. Especially after 2 years of being on treatment. So things that make you wonder about too many yeast is not getting better. All right. Number two, having increased sugar cravings. Number three, feeling a lot worse when you have anything that has sugar in it. Number four, intestinal gasiness and bloating, especially when you have sugary foods. Number five, if you're a female, periodic vaginal itching and vaginal discharge. And then the last thing that sometimes makes you think about too many yeast is having a lot of more problems than typical with pimples or acne or eczema or skin rashes. And what happens when you have too many yeast in the intestines is they release toxins that get into the bloodstream, interact with the skin, and they can lead to having more pimples and acne than typical, and can even result in your having worsening of eczema or skin rashes that might be there as well too. All right. So I would suggest, before you even go back to resuming your antibiotics, would be to explore and see, do you have one of these other problems? All right. And that's where I would suggest going. Okay. So let me show you a couple things that you can take a look at here. Oops, wrong thing there. Hold on a minute. All right. So, okay. So in my online Lyme guide, take a look at my section here called yeast, okay? And look at this article called A Silent Problem, Is It Yeast? Which talks about how you might go about looking to see if you have this problem, which is primarily based on symptoms, okay? All right. All right. And then the second thing I would take a look at is my article on mold toxicity. Somewhere. Oh, look in the detoxification section here. And then look at this article called this mold toxin illness article, where I talk about how do you figure out if you might have this, okay? Now, that's where I would start, all right? It may be this still is that you're just not, they haven't found a way to get at your tick-borne infections well enough. But again, when you're not getting better by this point, you've got to start wondering, is it something else? Okay? All right. Good luck to you. Hello, Zainab. Let's see. Since getting ill with Bartonella, Borrelia, and a plasma or leaky, etc., my neutrophil count has been incredibly low, although other symptoms have lifted over the course of my treatment, antibiotics, herbals mix, including my WBC count. My neutrophil count remains stubbornly low. Is neutropenia a symptom of tick-borne diseases? If so, which ones? And what can I action to dive deeper into this? Because I do not get sick more often. Actually, ever since catching Lyme, I get sick much less often. Doctors think it's benign ethnic neutropenia, but I am skeptical since I'm almost certain my neutrophil count used to be much higher. All right. So, I have seen Borrelia, Bartonella, even Babesia lead to immune suppression that results in low white blood cell counts. I have not seen isolated low neutrophil counts when the rest of the white blood cells are normal. So I don't think of this. I'm not aware that it would be a tick-borne illness related issue. Okay. I said, I'm not sure it is, I guess is a way of saying that. And it may be that there are some people out there that it is just how your genetic profile is that programs whether you're going to make these counts or not. Now, I agree. I mean, if it was more of a genetic related issue, heritage type issue, that probably this should have been going on before tick-borne illnesses. And so I don't know if you have a way of going back and looking at old blood counts from way before you got sick, just to compare and see maybe it was already marginally low, maybe it wasn't, I don't know. But I would not totally write off what your other doctors are saying, okay? There is a chance maybe it is tick-borne related, but it isn't something I've seen, okay? All right. Good luck to you. Hello, Kay. Let's see. Hi, I've had Lyme disease, Bartonella, and Babesia. I've noticed over the past few months, my lower back is killing me more, really bad. And my toxic skin look constantly. And then I had COVID in March. Let's see. I think I found the next part here. Sorry, that cut off. He said they've seen many people with severe back pain after COVID. I was wondering if it exacerbated the Lyme disease and Bartonella, or if this is long COVID, and I'm not sure what I should be doing. Okay, all right. So, I guess we all have different experiences as providers working with people with COVID. I will tell you, in my experience, I haven't seen back pain as the most significant symptom suggesting long COVID. All right, I just haven't seen it. Now, I'm not going to quibble with your provider's experience. Maybe he has or she has a different experience working with it, but that is not a common symptom that I have seen in long COVID. Back pain can be part of your tick-borne illnesses, although usually I would expect not just back pain, I would expect joint pains in general, not just located in the back, but located other places. If it is located in the back, and you're not having much of joint pains elsewhere, your providers should be looking to see, is this a non-COVID and non-tick-borne related issue. All right. Like, do you have a herniated disc? Do you have arthritis in your back joints? Because we have to keep in mind, people with Lyme get common things that happen in people without Lyme and without tick-borne illnesses. Okay. So if this is pretty much an isolated area, somebody I would hope would have gotten just regular back x-rays to see if it looks like there's arthritis in those joints from cartilage wearing down. And if so, then there's different things they can do for that. But and they may even consider getting an MRI to see, is there another cause that's not related to your infections? Okay. But again, that isn't something I have seen as part of my helping people with COVID and long COVID. All right. Good luck to you, Kate. Hello, Laura. Let's see. Hi, Dr. Ross. What are your thoughts on true dose therapy? Do you have any experience with it? Also, the adrenal supplement you recommended a few weeks ago is a great product. I appreciate your suggestion. True dose. I'm not even familiar with true dose therapy is. I'll have to look into that, so I can't comment. Okay, these webinars, sometimes you all point out things that get me thinking, and I look into it, but that is one I haven't heard of. I'll have to explore that when we're offline here later. Okay. All right. I'm glad to hear. So the adrenal supplement, everyone, Laura, I can't remember whether it was the ashwagandha I suggested, or it could have been something called energy multiplex, but I'm glad to hear whatever I suggested works for you. All right. Good luck to you. Greg says hi. Hello, Greg. Teresa says hi, Marty. Hello, and I think you were wondering why no one was here yet. I was, so I'm glad you connected, and I started right around 6 o'clock, so I didn't start right on the nose, but yeah. Hello, Chris. Let's see. Hi, Marty. Our daughter is about to begin taking methylene blue to aid her Lyme disease. Can you tell me, are there any medications that are contraindicated while taking methylene blue? Thanks. So so methylene blue, everyone, you may be aware, is a drug that we have repurposed to helping people with Borrelia and Bartonella. And what we specifically have found it to be useful for, based on laboratory experiments, is it can help with growing and persister Bartonella. It can also help break up Bartonella biofilms. And we know that it also will work on persisting Borrelia, which is Lyme. And we assume it works on growing Borrelia, but we don't have any lab experiments to tell us that. Okay, but we assume that it does, basically. All right. And it may work, if it's working on Bartonella biofilm, it likely works on Borrelia biofilm as well, too. All right. So I hope that everything I just said isn't foreign to you, but biofilms, everyone, are sugar slime layers held together in a fibrin protein skeleton that germs can develop to cover themselves and basically hide from the immune system and hide from antimicrobials that we throw at them. All right. And they occur in Lyme and in Bartonella. And then both Lyme and Bartonella have a growing state, and they have a hibernator state. And the hibernators we call persisters. Probably about 5%, 10% of the germs go into these persister hibernator states. And we think that the hibernators are responsible for why it's difficult to get people well. All right. Or one of the reasons. There's a lot of reasons, but one of the reasons. And our discovery, it's more of a recent phenomenon. Over the last 5 years, we started realizing there's these things called persisters. And the hunt has been on then in laboratories trying to find out, what do we use to break up those persisters? All right. And methylene blue happens to be one of those items. So methylene blue was manufactured as basically a clothing dye. I know you can buy it online, but keep in mind that stuff you buy online probably is not clean. It probably has toxic metals in it. All right. You can't get it through compounding pharmacies, though, who can put it in a capsule. And usually they're going to find pharmaceutical grade methylene blue and put it in those capsules. And there's some assurance that they're not full of heavy metal toxins, basically. It is manufactured, though, by pharmaceutical companies in an intravenous form. It is not manufactured by pharmaceutical companies in a capsule, right? Now, and the reason that we use it in medicine, or what it's approved for in medicine, is to treat a condition called methemoglobinemia. And it's a situation where the protein called hemoglobin inside your red blood cells that carries oxygen. There's a group of people that have this condition called methemoglobinemia, where when they get under stress, their hemoglobin doesn't release the oxygen, right? So they become their tissues become starved for oxygen. And in an emergency situation, we can give them an IV of methylene blue, which helps bump the oxygen off of the hemoglobin, and they start functioning a lot better, right? But we've repurposed it, and we've repurposed it to treating Bartonella and Borrelia. Again, we're using it to treat growing and persister forms, and we think it has some action against biofilms as well, too. All right. All right. So having said all that, all right, let me get back to your question here then. So the main drugs that we get concerned about are drugs that raise serotonin. So these would be antidepressant medicines, and they would be in the family called SSRIs and also in a family called the SNRIs. All right. So one of the SNRIs would be Cymbalta is one, for instance. All right. And the SSRIs would be Prozac, Celexa, those kind of medicines as well too. All right. So what you need to see is if you are on antidepressant medicines, are they an SNRI or an SSRI? All right. And what the issue is methylene blue is something called, and has the ability to be what's known as an MAO inhibitor. And it blocks an enzyme, which leads to elevations of serotonin in your brain. All right. And if you're on other drugs that raise serotonin, you can get too much serotonin, and then you get into something called serotonergic syndrome. Now, I sometimes have used methylene blue with people that are on one of the SSRIs or on an SNRI, but I'm usually going to want to have them take more like half dose of those medications rather than full doses of those medications. Okay. That is actually the only drug contraindication would be, or kind of a looser contraindication would be being on an SSRI or an SNRI antidepressant medicine. Okay. All right. Good luck to you, Chris. For those of you that want more information about methylene blue, I have a whole article about it describing even there's more benefits than just using it for tick-borne illnesses. It can actually help you with depression because it's an MAO inhibitor. Hold on here a minute. So methylene blue has many benefits, and we can use it for germ control. We can use it in methemoglobinemia. We can use it to help with depression because, again, it raises serotonin. It can help your mitochondria work better so that you get better energy to your cells. I'm just kind of looking all the way through here. Yeah. So anyhow, here's an article I have about methylene blue and all the various good things that it can do. It can even help with your thinking. Take a look at this article. It's called my methylene blue article. Okay. All right. Good luck, Chris, with your daughter. Hello, Chris, with a K this time. Hello, Dr. Ross. Thank you for all your information. It has helped me immensely. I use cryptolepis and get really hot at night. Is that a normal reaction? Thank you. Huh, interesting. So first of all, I'm glad you're finding the information I have out there helpful. That's what I'm trying to do, is help as many people as possible. So I'm glad for that. Cryptolepis, I haven't seen it. I have seen when people first start it can give Herxheimer reactions. And as part of the Herxheimer reactions from killing Babesia, if it's killing Babesia, because we can use Cryptolepis. Historically, we've used it to kill Babesia, right? And how we decided to start using it for Babesia is in Africa. It was discovered to be useful against malaria. Malaria and Babesia are both blood parasites. So we figured if it worked on malaria, it would work on Babesia. And then we've got research over the last year or two now that's telling us it's also useful against growing and persister Bartonella and Borrelia. So it kind of is a really good herb that can treat the 3 Bs, basically, right? Now, if you do have Babesia, it is not uncommon to get Babesia herxing near the time you first start the drug, right? And what a Babesia herx often will look like is a increased night temperature, maybe night sweats. It can give you air hunger. You can feel like you can't get enough air in. All right. So and you can get really bad fatigue. All right. It is true if it's also killing off your Bartonella and Borrelia, that's going to trigger more cytokines. Sometimes that gives you increased temperature. However, I wouldn't expect it to only be nighttime. That's the thing that's kind of throwing me on all that, because it often, if you're taking it throughout the day, I usually recommend 3 times a day. It wouldn't be just at nighttime. So no, I have not seen that happen as an isolated increased temperature just at night. Okay. And I would say it's probably not a normal reaction. Yeah. The other thing, Chris, I can't tell with the spelling of your name, whether you're a female, male, I can't tell that. And if you are female, we always have to start wondering about hormonal changes, especially in women that are getting your menopause years. That can give you increased temperatures at night. I guess I would need to ask you a lot more questions that I can't do in this forum, but I would describe what you're saying as not a common reaction. Okay. All right. Good luck to you. Hello, Sandra. Let's see. Thanks for everything, Dr. Marty. You're welcome. Quick question. I am being treated with low-dose amoxicillin for Lyme, Bart, and Babesia. I'm going to incorporate some herbs. Some other Lyme friends have suggested that IV antibiotics is the only way to go to get better. What are your thoughts on IV versus oral antibiotics if I've had these infections for years? Thanks so much. All right. So first of all, the amoxicillin, I just want to make a comment on that. Amoxicillin is only going to be useful against Borrelia. It's not going to do anything for Babesia and Bart. You may know that, but I just want to say that. Okay. All right. So the question about whether to use oral versus IV antibiotics has something that's evolved over time. And it used to be, about 20 years or so ago when I first started helping people with tick-borne illnesses, there was what I would describe as a East Coast school of thought and a West Coast school of thought. And at that time I was in Seattle, so I knew very well of both schools of thought, right? So the East Coast docs were doing a lot of IV antibiotics back then. They thought that was the only way for people to get better. The West Coast docs were having a different experience. They were using mostly oral antibiotics, all right? And so I think over time, even the East Coast docs, the majority have migrated away from doing IV antibiotics, but that thought that maybe IV antibiotics are better still has a hold out there, right? So here's what I see. So IV antibiotics versus oral antibiotics. So for Borrelia, oral antibiotics tend to work about any ones that you initially go on have an 85 to 90% chance of helping you. And if they don't work, then we go to something else, okay? But any 2 or 3 you go on at once have an 85 to 90% chance of helping you, all right? Versus IV antibiotics have about a 90 to 95% chance of helping you. So there's about a 5% difference in the effectiveness of IV versus oral antibiotics. Now, that is balanced out by a number of things. Number one, cost. Typically, insurance companies for Borrelia will pay for a month of IV antibiotics, but they're not going to pay for beyond that, okay? The other thing that happens from a health standpoint is there are risks in doing IV antibiotics. And that is, if you're going to have daily IV antibiotics, we're usually going to want to put in an intravenous line and leave it in place. We're either going to put it in your arm, and that's something called a PICC line, where the tube sits in your, basically we put it in out here, we feed the tube through your blood vessels so it sits all the way up about here, or we're going to put something called a central line in, where we go under your clavicle and we stick it in the big vein under there and feed it down so it's about the same spot, okay? And we leave those lines in place. They have to have weekly dressing changes to keep the site sterile. And then you inject the medicine on your own through the IV port, all right? The problem with these lines, though, is that the tip that sits here in your big vein has potential of developing blood clots. And if you develop one of those blood clots, they can break off, float downstream into your lungs, and kill off part of your lung, okay? We call that a pulmonary embolism. The other difficulty with these lines that we have to leave in place is that they can get infected, either through, even though you have sterile dressings, they can still get infected through there, or it's a tube hanging out of your body. And sometimes germs, even if you try a sterile technique, will work through that tube up into your bloodstream, all right? So over the course of about 6 months that somebody might be on one of these more permanent lines, a PICC line or a central line, there is about a 15 to 20% chance that you will have a complication that we have to pull the line out. All right, so it could either be infection in your bloodstream, or it can be one of these blood clots. And so because of all that, and because of cost, most of us don't do IV antibiotics anymore. And we find that people get well with about an equal chance of getting well doing the oral antibiotic regimens. Okay? All right. Good luck to you. Hello, Carter. Hold on here just a minute. Let's see. Is there a hierarchy to the degree of these infections? I've heard some people say that a healthy spleen and immune system will keep Bartonella and Borrelia under control, as they are fairly common. On the other hand, I've had other people say that if you have Borrelia, you absolutely need to treat it, and your odds are low that your body will control it without intervention, unless you're a rare exception at the prime of your life. All right. So it's an interesting discussion. So there are people like, there's a physician out in the Seattle area named Dietrich Klinghardt. Many of you may be aware of him. So Dietrich thinks that probably everyone's been infected by Borrelia. I mean, that's how he looks at it. He thinks it's a very common infection, and that most of us have immune systems that are able to deal with it, and it won't cause any problems. I don't know that I agree with him that it is 100% of people have it, okay? But I do think it is quite common that there are people walking around out there that had it and their immune systems dealt with it, all right? So for instance, I had been in a relationship at one time with a woman that had tick-borne infections. And as I was leaving that relationship, I decided just to see, did I have any problem with tick-borne infections? And so I did a Western blot test for Borrelia, and my Western blot lit up like a Christmas tree. I mean, I've never seen such a positive test, all right? But I'm healthy, and I was healthy back then too. And so my interpretation is either exposure sexually, or because I used to be an avid backpacker in the middle of the wilderness of West Virginia and Virginia when I lived out on the East Coast, it's likely I may have even bit when I was out there. It had nothing to do with my partner, okay? But what that says to me is I'm healthy, and I think my immune system dealt with it. And I think a lot of people have immune systems that can deal with Bartonella, Borrelia, and Borrelia. And so it may just be that there are certain people where your immune systems are not tuned in a way that they are able to deal with it, okay? Let me see, did I really answer your question here? So I don't think it's the exception that people have immune systems that can take care of Bartonella, Babesia, or Borrelia. And it would be interesting if we could look at that. Maybe it's more of an exception that people actually get sick from these infections. We have no way of knowing, though. Okay, no one's done those studies to tell for sure. All right. Good luck to you, Carter. Oh, I'll share one other thing with you too. So, you know, one of my jobs when I was treating people clinically was to figure out what's causing your problem. All right. And so I would have people that would come in with having seen other providers. And because over time I became the doctor that everyone would go see when they weren't getting better, or other physicians would send people to me to help figure out, okay, I became one of those kind of experts, right? So I would get people that had testing done elsewhere that would come in and wanting me to help them. And so there's a number of times where I have similar stories where somebody would come in with very, very positive testing for tick-borne infections that was positive, especially Borrelia, and have significant symptoms suggesting Borrelia, like severe brain fog, bad fatigue, neuropathies, you name it. I mean, the whole host of things that really did look like it was Borrelia and maybe co-infection. But when I would sit and I would take their story, I would say, well, tell me more about what was happening when you got sick. And a number of times what I discovered is people got sick when they had just recently moved into a home that had mold toxins in it. They had black mold living in the room back where the fish tank was, for instance, okay? And a few times, even though they had solidly positive tests for Borrelia, symptoms that looked like it, when I heard the story that said they got sick when they moved into that house, I knew immediately to look and see, could there be mold toxin illness involved? And I did. And I did look to see if they had mold toxin illness, and I found that they did. And in a number of instances, all I did for those people was treat their mold toxin illness. I never did anything to treat the positive tick-borne infection testing because I think their immune systems had dealt with these infections. Keep in mind your Western blots and your ELISpots that we do to see if you have tick-borne infections are immune reaction test. They don't tell you is the germ still in you. It just says you had an immune reaction, all right? And these immune reactions may not go away. So it's very possible, I think, that our immune systems have the ability to deal with these, okay? All right. Thanks for that question. Hello, Carter. Let's see. I know they generally say cytokines are the symptoms of these infections, but there has to be a lot more going on than that because the symptoms are so unique to these individual infections. What is the mechanism of action? Burning soles of Bart deja vu for Babesia, migrating joint pain for Borrelia, etc. If it was just cytokines, then the symptoms would be more standardized like the cold or flu. Now, I agree with you. What I have said is the majority, a great majority of the symptoms are caused by the excess cytokines. In addition, each of these germs has different effects on the tissues that they infect, which gives you some of these different symptoms, basically. Okay? All right. Thanks for raising that point. Let's see. One more from you, Carter. Let's see. Pardon me if it's too personal, but I wanted to ask if you or your family, regardless of Lyme or not, take any of the herbs, supplements, and peptides. Are there any suggestions for diarrhea, such ability to norovirus from traveling, etc.? Any suggestions for seizures? All right. So I've had family members that have used a number of the herbal antibiotics that I recommend. I have friends that have used the herbal antibiotics I recommend. I myself, for various reasons, have done the peptides that I recommend, various ones of the peptides, okay? So to answer your question, yes, yes, and yes, all right? And then let's see, any suggestions for diarrhea, norovirus from traveling? All right, so in terms of trying to prevent traveler's diarrhea or viral diarrhea, probiotics. And I probably would wind up using a spore-forming probiotic. Spore-forming probiotics are ones that come from soil. They form spores, which makes it so they could easily get through your stomach, the acid of the stomach. And then within the intestinal tract, they don't actually implant, but they send out a bunch of chemical messengers that help promote healthy growth of your good bacteria in your intestines. All right. So there are some studies that suggest that if you are on probiotics, it prevents you from getting bacterial diarrhea and even viral diarrhea as well too. All right. All right. Thanks for your question. Good luck to you, Card. Hello, Teresa. Let's see. Is NAC and glutathione the same? Can you tell me the difference between them? So they're not the same. So N-acetylcysteine, NAC, is one of the chemical building blocks that leads to glutathione. All right. And so I usually don't suggest people take both. I find giving the glutathione itself to be stronger than giving the building block. However, there are some people that cannot afford the glutathione, or there is an occasional person that will react to glutathione, but they can tolerate taking the building block. All right. So, anyhow, that's how I use them. If I have somebody that has a reaction to glutathione or cannot afford it, then I'm looking at doing an N-acetylcysteine to raise glutathione. And it's the dose that would do that I usually recommend is 500 milligrams twice a day. Okay. All right. Thanks for our question. Hello, Eliza. Why are we unable to get tefenaquine? For some reason, the manufacturers are just not ramping up production of it. And I don't understand. We go through phases where they do make enough and then they don't. So it's a supply chain issue. As an alternative to tefenaquine, I often have used another member of that same family. That tefenaquine is in a family called the primaquines. And I'm sorry, the quinolines, excuse me, the quinolines, and the other quinoline is called primaquine, which I think can work quite well as well too. All right, let me show you an article where I talk about both of those in terms of helping with babesia. Hold on here just a minute. Let me do a screen share. All right, so take a look at my article called Kills Babesia, Brief Guide, somewhere down here. Here it is. All right, and in here I walk you through the steps to treat babesia. But in terms of the treatments, there's a group of treatments I call the tier 1. These are the ones that have the greatest chance of working for you. And there are ones that are atovaquone based, and then there are ones that are quinoline based. And the two quinolines are primaquine and tefenaquine. All right. And so if you cannot get tefenaquine, then often an alternative is to go more with a primaquine based treatment. Okay. All right. Good luck to you. Hello, Joe. Thank you for taking my questions, Dr. Ross, and for all. Thank you for taking my question, Dr. Ross, and for all you do. Oh, got it. All right. You're welcome. Good. My adult son has metastatic adrenal cancer, Lyme, tick-borne relapsing fever, ehrlichiosis, and babesia microti. He takes Herxes for pain, which is morphine, anxiety, and another to lower blood pressure. Is it safe for him to take these supplements? And if so, what doses? Hold on just a minute. So you want to know if it's safe to take the cryptolepis, Chinese skullcap, the cinnamon clove oregano, artemisinin. So, Joe, ultimately, I would talk with his healthcare providers because I'm not his doctor, and I understand that there are, he's got his adrenal cancer and he's got his various tick-borne infections. Okay, but just based on what you wrote here, I don't see a reason that he cannot use those. But again, I'm cautioning you that I don't know all about his health just based from what you wrote there. Okay, all right. Thanks for our question. Hello, Laura. Let's see. Hi again. Is there such a thing as IV probiotics? No, I'm not aware of IV probiotics because, again, you want the probiotics to get into the intestines, all right? You can take oral probiotics. There are some people that do rectal probiotics, but I haven't heard of intravenous probiotics, okay? Hello, Kay. Let's see. Thank you. Yes, I've had some mild arthritis in my back, x-rays and MRI last year. It just got so much worse after COVID, along with my toxic skin look I get, but being constant. Could COVID have affected my immune system, making the Lyme worse? When the ortho said they have seen many severe back pain after COVID, I wondered if they also had tick diseases. I'd rather not have to be searching for remedies for long COVID too. I have also been very zoned out and lethargic. Any suggestions for treating the low back pain and tight the IT bands from infection standpoint? Thanks again for all you do. You know, I don't have a specific infection recommendation, but you may want to look at physical therapy. Obviously, I'm going to say some of the standard things, but also I find in situations like you're describing, a traditional Chinese medicine, acupuncture, sometimes can be useful in these situations as well too. And beyond that, I really would need to talk more with you and get some more specific questions answered that I can't do in this kind of a format. Okay. All right. Good luck to you. Hello, Karen. Let's see. Hi, Dr. Marty. Thank you again for your last advice. You're welcome. I can't remember what I said, but you're welcome. Let's see. I contacted you 3 weeks ago about our 8-year-old daughter who had a bullseye rash after a tick bite. She received 3 weeks of doxycycline and now 3 weeks of amoxicillin. She is symptom-free since day 3 on antibiotics. I read your article about testing and I'm aware that there is no such test existing that tells me the treatment was successful. Would you nevertheless test her? If so, which test? Or only watch for symptoms? Thank you. You know, unfortunately, again, as you just said, there is not a test that tells us that you're done. Now, at this point, if you're wanting to do a test to see if she truly did have a tick-borne infection and what they were, 6 weeks out is enough time that the immune system would have made antibodies by now. So if you're wanting to explore what the infections were, I would suggest getting the immunoblot methods that are done by IGeneX for Bartonella, Babesia, and Borrelia. And I would look to see if she has the immunoblot method is a way of looking to see if there are antibodies the immune system made against these infections. And I would do both the IgM family test and the IgG family test. So your body makes 2 types of antibodies when somebody is infected, IgMs and IgGs, and I would explore both of those too. But use 85 to 90%, well, about 85% of the time, probably 90% of the time, the 6 weeks of antibiotics that she's been on would have taken care of anything. Okay, so it's up to you. I would probably pursue more of a wait and see approach and not spend the money on the testing, but I can understand your concern. Okay, all right. Good luck with your daughter. Hello, Eliza. See, what are your thoughts about Babesia oticoli and resistance to tovacone and being difficult to detect by testing? So The predominant strains that we have historically known for Babesia has been Babesia microti and something called Babesia duckani. We also now know that there is another strain that we have good evidence from animal studies called Babesia oticoli that is pretty predominant in the East Coast, Midwest. And because it is so prevalent within animals, there are people that wonder, is it very prevalent in humans as well too? All right. Now, one of the big advocates saying that probably most Babesia that everyone has is Babesia oticoli is a physician named Dr. Harry Lidner. And he's very vocal about his belief, and I'm calling it a belief, that most of Babesia out there is oticoli. There are other people that have looked at, done studies on all the blood samples they get for people that are being tested for Babesia. And they test to see, do they have the DNA of Babesia oticoli, microti, and duckani. And what they're basically finding is there's limited amounts, limited to rare amounts of Babesia oticoli. So the testing of screening large samples of blood that people send in suggests that probably Babesia oticoli is not as prevalent as what Dr. Lidner is screaming to all of us that he thinks is the major strain. All right. And I will tell you, the majority of people that I have treated for Babesia, I never put on tefenoquine. I usually do have good luck getting them better with a atovaquone-based treatment. So I disagree with Dr. Lidner. And the trouble is, everyone hears about Dr. Lidner because he's so vocal about it these days, but I think he's wrong in many instances, okay? Now, that being said, I do think some people do have Babesia oticoli. Right now, the only way that you can see if you might have, there's a few ways to detect if you have Babesia oticoli or might have Babesia oticoli. So IGeneX, in its immunoblot test for Babesia, immunoblot is looking to see, do you have antibodies against Babesia? And in the IGeneX testing method, they look to see if you have antibodies against Babesia duckani, Babesia microti, and the Babesia family, all right? And so if your microti and if your duckani tests are negative, but your family test comes back positive, it may mean your Babesia is oticoli, okay? That's a possibility. In addition, a lab called T-Lab, which is a newer lab, is offering a microscope exam of your blood, and they basically are able to detect very small amounts using a marker method that they have, and they now have a probe that looks to see if you have Babesia oticoli. The trouble is with this microscope test is we don't know how sensitive it is at picking up Babesia. Meaning when you put a needle in a person's arm and you draw their blood, are the germs that you're trying to detect really swimming by that small sample? All right. Antibody samples, on the other hand, are not reliant on whether the germ swims by your needle at the same time versus these marker ones like T-Lab does. You have to have, the sample has to have, if the Babesia didn't swim by the needle at the same time, you may miss it, basically. Okay? All right. Thanks for the question. All right. Bear with me. So I'm looking, there's two ways that questions show up on my side. One is this chat box that looks like there's two talking people together, and there's the Q&A one, and I see a number of you have posted in both places. I just went through all the ones that are in that looks like the two talking speaking blurbs, and now I'm looking over at my Q&A box, and I'm just seeing some of it looks like a lot of you wrote questions in both places, so just bear with me while I thin this out here. All right, so here's a question from Teresa. Hello, Teresa. Is Armin testing any good? If it is it as sensitive as IGeneX? Getting Borrelia, Babs, and Bart testing for nephew. All right, so it's it's okay. It's not great. There's problems with it. Okay, so I have a whole article that I'll point you to in a minute where I argue that actually the testing through IGeneX is the way to go. It's more expensive, but it's more accurate. All right. So Armin and another lab here in the United States called InfectoLab use a testing method called an ELISpot test. All right. And that is a little bit different than the method that IGeneX uses, which is called an immunoblot. All right, an immunoblot that IGeneX uses is measuring antibodies against the various strains that they test for, okay? And for Borrelia, they're testing to see if you have antibodies against 8 strains of Borrelia. For Bartonella, they're testing to see if you have antibodies against 4 specific strains and the whole family of Bartonella, meaning they can pick up all 15 Bartonella strains that it can infect a person. And then on the Babesia, again, they test for 2 specific strains and then the whole family. So they can pick up like 15 to 20 strains of Babesia that might infect a person, right? So IGeneX, with its immunoblot antibody test, is able to screen for a lot of things, all right? All right, now let's look over at the ELISpot test. So an ELISpot test that is done by InfectoLab and by Armin Lab could also be called a T-cell reaction test. So your T cells are the type of white blood cells that attack viruses and bacteria when they get in you, all right? And so what happens in this T-cell activation test is we draw your blood and we pull out the T cells and we put them in a test tube, and then we introduce into the test tube proteins against the germ that we're trying to see if you have. And then we see, do these T cells react? All right. Do they make a cytokine fingerprint that they would make if they had seen these proteins and tried to attack them before? Okay. All right. Now, in terms of the sensitivity of the test, this is where we run into trouble. The Armin and InfectoLab, Armin is testing if you have antibodies against Borrelia burgdorferi, a T-cell reaction against Borrelia burgdorferi and against 2 European strains, Borrelia guerini and Borrelia, I'm blanking on the third one. Anyhow, they're looking for 3 strains, okay? InfectoLab is only looking to see if you have a T-cell reaction against Borrelia burgdorferi, right? So they're not looking, either one of them is not looking to see if you have reaction against as many strains as what IGeneX does, all right? So they're going to miss stuff on the InfectoLab, all right? And then for Bartonella and InfectoLab and Armin only look to see if you have T-cell reaction against Bartonella henselae. Again, we actually think there's 15 strains of Bartonella. And for Babesia, they're looking to see if you have reaction against, I believe, just against Babesia microti. And again, they may be missing the other 15 to 20 strains, all right? So for that reason, I don't advocate doing the Armin or InfectoLab ELISpot because they're not testing against enough stuff, basically, okay? That's my feeling on that. Let me do a screen share where you can read more details about this as well, too. All right, look down here. I guess I don't have it there. All right, here, let's put up here. Best test. There you go. All right, so there's an article I have called The Best Lab and Test for Borrelia, Bartonella, and Babesia. And in here, I explain the problems with Armin. So Armin, again, looks for Borrelia burgdorferi, Borrelia afzelii, that was the one I'm forgetting about, and Borrelia guerini. And again, they just, for Bartonella and Babesia, both of them only look for 1 strain. Okay, so you're going to miss stuff, basically. Okay. All right. Thanks for that question. Let's see. That one. So a lot of these that I'm going through right now are duplicate questions. So hold on just a minute. Teresa, I answered your question earlier about the glutathione and NAC. Okay, you thanked me for that. That's good. All right, so right now, I just want to let you know we're at 7:11 in the evening, and I basically went through all your questions. So if you have any other questions, I'll wait here a few minutes to see if anyone else has another question. But if not, I'll be moving on to the next part of my evening, and Mr. Thor, my Basenji, that is wanting some attention here, basically. Yeah, I'll just give you here a second here. Oh, so again, tomorrow morning, everyone. Again, I will be sending out an email notifying you that the recording has been edited, and I will create a synopsis of that recording as well too. So take a look. I should have that out to you somewhere probably tomorrow morning before 8 a.m. because I have another appointment I got to be at here in town in the afternoon. So look for that. Okay. And I think that's it, everyone. I don't see any other questions coming through. All right, everyone. Good to see you tonight. And I look forward to visiting with you next week. Good night.